I'm using inductive shortwave diathermy for my 64-year-old patient with right knee osteoarthritis to decrease their perception of pain. Non-thermal diathermy is appropriate for my patient because they are not in the acute phase of OA, and OA is typically not an inflammatory condition like RA. Also, they're 64 years old, so there's no concern about skeletal immaturity or a growing epiphysis. Prior to starting diathermy, there are some general things that I would gather from the patient's history to make sure it's not contraindicated. For example, pregnancy, implants, and pacemakers. Also, I would check the patient's skin sensation prior to using the modality to prevent burns, and also general cognition. Okay, so I'll have the patient remove all the metal clothing or jewelry from the area, and I will tell them that we are sitting on this wood table and using this machine called Diathermy. I'll be standing a little further away from you, but I want you to let me know if you feel any pain or heat, because you should not be feeling any heat at all or pain, and I can turn down the intensity. We're going to be doing this for about 30 minutes. Also, I'm going to be placing a towel over the area, over your knee, between you and the machine. So we are going to put the diathermy machine as close as possible to the skin that we can get and record how close it is to the skin. We'll also record that it's set at 27.12 megahertz. Next, we will press the on button and set the waveform that we want. We want pulsed for non-thermal. Next, we'll set it to 200 microseconds. Then we will set it for drum application and then the timer for 30 minutes. Now we will press start, then increase the power, which I will increase to 25 watts. And in a few minutes, I'll ask the patient, are you feeling any warmth? To which I would expect the response to be no, and if it were, I would turn down the intensity. Also, I would like to be 1 to 2 feet away from this machine while I'm performing it. At the end of treatment, I'll press the off button, remove the cloth in the machine, and ask the patient how they're feeling. As a side note, I chose 24 watts because less than 38 watts is typically non-thermal.